Our next witness is Dr. Weisman, who will share with us her extensive experience in enterprise working on mental health issues surrounding young people in the juvenile justice system. In her current position, she oversees all medical and behavioral health services for youth detained or committed in Washington, D.C. She has served in many director positions as a mental health expert in court cases and authored papers on the mental health needs of incarcerated individuals and how conditions of confinement as they impact the mentally ill. We expect to learn from you about what we can do to improve the juvenile justice system in regard to mental health.
Thank you for the opportunity to speak to the subcommittee, to the members of the Subcommittee on Healthy Families and Communities. I'm a doctor of clinical psychology and the director of health services at the District of Columbia Department of Youth Rehabilitation Services. Prior to my current position, I was Director of Behavioral Health Services at the Maryland Department of Juvenile Services. Public officials and advocates in both mental health and juvenile justice welcome your concern about the very serious issue of the prevalence of mental health disorders among youth who come into contact with the juvenile justice system. While juvenile arrest rates have generally declined since 1997, there are still over 2 million youth who are arrested and who come into contact with the nation's state and local juvenile justice systems each year. The now widely accepted prevalence data indicate that as many as 70% of youth who come into contact with the system have one or more diagnosable mental health disorders, and that as many as 25% suffer serious disorders causing impaired functioning in one or more life domains. By comparison, it's estimated that 10% of children and adolescents in the general population suffer from mental illness severe enough to cause some level of impairment. But these data alone fall short in really understanding the complexity of the issues our youth and our systems face in addressing these problems. There are other statistics we need to consider to really put this into context. For example, children of color are disproportionately represented in juvenile justice systems across the country. The data clearly show that youth of color are more likely to be arrested, locked up before trial, sent to state facilities after adjudication, and spend more time incarcerated than white youth, even when they're charged with the same categories of offense. But there's one more context-setting parameter. There is growing evidence documenting the nearly pervasive experience of trauma among incarcerated youth prior to incarceration. Some studies report prevalence rates as high as 93% for boys and 84% for girls. Trauma refers to the experience or exposure to violence, physical, sexual, or emotional abuse, or neglect. Trauma for these youth comes in the form of family violence and close contact with violence among friends and in their communities, in addition to being victims. The trauma our youth have experienced is pervasive and it is multi-generational. If we don't treat the whole family system, we will be less successful in responding to the needs of our youth. Juvenile justice systems have struggled to develop the range of behavioral health services that satisfactorily address the needs of children and families. For example, the partnership between the MacArthur Foundation and the National Center on Mental Health and Juvenile Justice through the Foundation's Models for Change initiative has led to some significant improvements in the collaboration strategies between state-level mental health and juvenile justice agencies. In addition, SAMHSA's Center for Mental Health Services system of care work in numerous states has provided both the philosophy and the strategies for interagency collaboration among child-serving agencies, including mental health, child welfare, education, and juvenile justice. Children and adolescents cross multiple agencies and programs, and services must come from the combined efforts and collaboration among them all. There are several core values and strategies in approaching these problems, many of which are already embodied in the Juvenile Justice and Delinquency Prevention Act. We must deinstitutionalize status offenders. For status offenses are those that only a minor can be charged with, such as truancy, running away, and curfew violations. These are the very behaviors we would expect from a youth being sexually abused or otherwise traumatized. Incarceration is not good for anybody, and for traumatized youth, it recapitulates their original trauma experiences. A critically important development in recent years is the systematic identification of youth with mental health or substance abuse disorders as early on as possible. We must screen youth with validated instruments upon their first contact with juvenile justice agencies, and this screening must lead to culturally sensitive, evidence-based treatments, whether within juvenile justice agencies or facilities in the community. We must divert youth whenever public safety concerns allow, and redirect them to community-based treatments with proven effectiveness. We must use evidence-based treatments. Quite a lot is now known about the kinds of services and supports that work most effectively with the juvenile justice population. These interventions bring therapeutic services into the home in varying degrees of intensity and duration to work with the youth and family in natural settings. And we must keep youth out of adult jails. They suffer significantly higher negative outcomes than youth in juvenile facilities, from higher suicide rates to increased likelihood of being victims of assault or abuse. And when they are in adult jails, we must keep them sight and sound separated from adults so as to minimize the likelihood of their being abused or exploited. And states and local jurisdictions must be held accountable to assess and address the racial and ethnic disparities affecting youth of color that exist throughout the juvenile justice system. These basic protections must be a priority for this committee to ensure that youth in need of mental health treatment who come into contact with the juvenile justice system are, whenever possible, able to receive effective services in their homes or in the community. And these are the protections afforded by the JJDP Act. Thank you.